Well, Toni, thanks for joining me today. I'm Jennifer Stevens, and this is going to be our podcast number 2 for our series on Wyoming nursing history. It's January 26, 2026, and I am here speaking today with Toni Decklever. We are in Cheyenne, Wyoming. Toni, thanks for speaking with me today. I really appreciate it. We have some really good questions, and we're going to talk about your nursing career here in Wyoming.
Thank you for inviting me.
So, Toni, can you talk to us about what you are currently doing in nursing here in Wyoming?
Currently, my most active nursing role is as the lobbyist for the Wyoming Nurses Association.
So before you became the lobbyist, and that's how I met Toni, is through the WNA, you want to walk us through your background? How did you become a nurse, and how did you specifically do nursing here in Wyoming? Well, let's do those early years.
Okay. So I graduated from the University of Northern Colorado in Greeley, but I was living here in Cheyenne. So as soon as I graduated and passed my NCLEX, I applied at the hospital here in Cheyenne. It's called, at the time it was Memorial Hospital of Laramie County. And started on the medical floor because that's where new graduates always start. So I started on the medical floor and did the medical floor for about a year or so, and then requested to be transferred to labor and delivery. And so I worked in labor and delivery for a number of years and wanted to grow and be more part of the leadership, but the hospital at the time wasn't as enthusiastic as I was. And so I left the hospital and took a job as director of nursing at a new long-term care facility that was here in Cheyenne. And that went okay, except that I really didn't have much experience. And so the executive director suggested that maybe I go into the assistant director of nursing position, and they brought in a more experienced DON. And part of my job as the assistant director of nursing was staff development. So that was in 1989, and that was when the nursing assistant program became mandatory. So I started teaching nursing assistants at Life Care. I developed the program and then began teaching as an instructor the nursing assistants at Life Care.
So let's back up a little bit, Toni. So tell us, when you were at UNC, what years were you in school down there?
So I was 1979 to 1983.
So you graduated from UNC with your bachelor's of nursing in 1983.
Right.
And then you brought your nursing degree and your desire to work up here to Cheyenne, where you had been living.
Right.
At the time in 1983, were there many other bachelor prepared nurses in Cheyenne?
I honestly couldn't not answer that. Part of my choice to go to UNC was because at the time they had a very high pass rate on NCLEX, and so that kind of pushed me there. I started at LCCC, the community college here in Cheyenne, to do my basic stuff, but I always knew that I wanted to get a bachelor's degree. That was, the ADN just wasn't even an option for me. I really wanted the BSN, and so since UNC had such a high pass rate, I thought, well, that was my choice. That was why I went there, rather than UW. At the time, UW's pass rate is very, very good now, but at the time, it was not as good as UNC's. So that kind of drove my choice.
Yes.
Yeah.
I have heard that. When you went to work at what has become Cheyenne Regional, and back in the day it was Memorial, tell us a little bit what it was like in the early 1980s to be a nurse here in a rural setting in Wyoming at Memorial Hospital, which was probably and still is the premier hospital of Wyoming.
Yeah. Well, it was the only hospital. Actually, at the time when I started at Memorial, Cheyenne had 2 hospitals. We had DePaul Hospital, which was on one side of town, and Memorial was on one side of town. But DePaul was mostly pediatrics, and they had an emergency room, and they had behavioral health, and I did not want to do pediatrics, and so that's why I chose to go over to Memorial, because they had more of the adult population, and they had labor and delivery. That was what I really, really wanted to do. Coming out of school, I had done they call it capstone, but they called it special emphasis, and so I had spent quite a bit of time in L&D as a senior, and I wanted to go right into it, but at the time, you couldn't. You couldn't go into a specialty area. It had to be medical first, and so that's why I ended up at Memorial. But at the time, we were still paper charting. We were still pouring our own medications into little medicine cups, and then we had little cards, and we had a tray, and we would go around and give meds to our patients that way. When we would come out a report, everybody would go congregate in the med room, and they would pour all of their own medications for the day. While I was there, we moved into a unit dose kind of system where we had the cart, and then the pharmacy would bring, they would send up the meds for the day, and we had the bubble packs that we had to, push out, put into a cup, and then hand it to the patient. So the difference between what I was doing in the hospital and what they're doing now is everything is computerized. Charting is computerized, meds are computerized and monitored via computer. Everything is more at the bedside, where we had paper charts and we had to write. It was so long ago that we were 8-hour shifts. So the day shift would chart in red or black, the evening shift would chart in green, and the night shift would chart in red, so that when you opened the chart, you could actually see what shift was writing different things. So yeah, those were the days we used paper, and we don't use as much paper anymore.
Those were the days, Toni. I remember some of this. Yeah, indeed, I do remember it.
The Cardex and the MAR, and back in the day.
In written shift report.
We also wore uniforms, white uniforms.
And did you wear a cap?
No cap.
No cap.
That wasn't
not
required.
Even in your nursing school.
No. No. We had the type of cap in my nursing school kind of came out like this, and somebody poked somebody in the eye with the cap, and so they said we don't have to wear the caps anymore. But
were you wearing skirts?
Yeah.
Were you wearing skirts?
Yes. We could have dresses. We could have pants. I mean, we could wear slacks if we wanted to. But I still have my very first white uniform dress. Can't give that up.
So how long were you at CRM's Memorial?
Yeah.
And then why did you decide to transition then? Tell us a little bit more about that.
So I was there about 5 years, and I still remember going to the charge nurse and asking her that I wanted to play a bigger role. I wanted to be a charge nurse. I wanted to learn how to be the unit manager. And at the time, they just didn't have those kinds of things for nurses, and like they do now, where they have training and you move into leadership. I mean, even leadership degrees were unheard of, and so the reaction I got was more, thank you for wanting to move up, but it really just go be a good little staff nurse and for a while longer. And I'd been at the hospital for about 5 years. I felt like I needed to step up a level, but they just weren't ready or they didn't have any positions, or they didn't have any programs to help nurses transition from staff to charge. So I said, well, they have a leadership position at a long-term care facility that had just opened up. I knew the executive director, so I called him and I said, I want to do more. I want to do more. And I love my work. I love labor and delivery, and I love my patients. But I just wanted to do a little bit more. And so he allowed me that opportunity to do that. Unfortunately, I wasn't prepared for it because I hadn't had any training. They just stuck me in the position because I wanted it, not because I was qualified. So I didn't do very well.
Do you think that a lot that might have had to do with it being rural and having a smaller pool of people trained in admin or leadership?
Possibly, but part of it was just desire. And I mean, even now, If somebody wants to go into a long-term care facility and be the director of nursing, they're more than happy to. I mean, it's nice if you have some experience, but unfortunately, that position, there's a high turnover. And so if someone were to come in with experience, that would be gold. But someone who wants to come in and is young, enthusiastic, and wants to learn, then they, at the time, it was like, yes, we'll take you. We'll take you first, put you in the position, and then we'll train you later. Well, that doesn't work very well. So because I struggled, I didn't know what to do. I knew how to be a nurse, but I didn't know how to be an administrator. And so that's changed now. I think that there are more opportunities for people to get some training before they go into a leadership position. But at the time, it just was all about initiative and enthusiasm more than qualifications. It felt like
trial by fire.
Yeah. And yet, when I didn't do very well, the director did not want to lose me. He told me, he said, "I love your enthusiasm. I love your initiative. I don't want to lose you as an employee. But you're not doing well in this position. So I'm going to find somebody that has experience to come in, and you're going to learn from her. But meanwhile, I'm going to put you as her assistant so that you can learn from her, and then and do training, because that was just part of the job."
So were you then in that mentorship role, right? A nurse mentorship role when the CNA training opportunity arose. So tell us about how this idea that nursing assistants need to be certified in the nursing home and the politics around that. To tell us about how that developed.
So in 1987, the federal government passed a law. It's called OBRA 87. And basically because based on surveys and different things, people were going into long-term care facilities that were receiving Medicare money. But none of that money was going to take care of the patients or the residents. So the residents were receiving absolutely abysmal care. And so the federal government said, facilities, if you want our Medicare money, then you are going to have to train your people on how to take care of these residents. And it was only for long-term care, because they're such a vulnerable population, and they're in long-term care facilities for an extended period of time. So they passed OBRA 87. It went into effect in 1989. And basically, the feds wrote the law that said, if your facility wants Medicare money, then you must follow these rules. And it was put into law. It's in the Code of Federal Regulations that stated anybody working in a long-term care facility must go through a course. And it had to be state approved. And they had to go through a course that the state approved, and they had to test. And the test had to include knowledge test and a skill test. And that is and then the law is very specific as to what the curriculum, what has to be taught in the class. It's very specific that the number of hours of the class must be 75 hours or more. And it is in the law that it must be taught by a registered nurse that has been an RN for 2 years, but has 1 year of long-term care experience. And so, and that's in the law.
Yes.
Well, that became effective in 1989, and we did our first round of testing CNAs in 1989. And the feds allowed people that had been nursing assistants for years and years and years to test out. So that was the first year. If they had been working in a long-term care facility, they could actually take the test, and if they passed, they would get a CNA, so a certification as a nursing assistant. Before then, we were just NAs.
There were nursing assistants, but they were not certified
by the state.
Did the federal government give the state the criteria from which to count somebody as certified?
Yes.
So federal gave the curriculum to the state of Wyoming. So in Wyoming, that was you?
No, it went to the Board of Nursing.
So to the Board of Nursing. And then, so the federal government gave the curriculum to the Board of Nursing. And so tell us about how that process all developed then.
So then what would happen is that programs, whether they were in individual facilities or wherever they were, they would have to write out their program, what, how many hours how many hours they were going to meet, how many hours per day they were going to meet, the facility that the class would be held in, the qualifications of the instructor. I mean, you had to submit a program to the state, and the state had to put their stamp of approval on it and say, yes, you are approved. Because Medicare knew that this process was going to be lengthy and costly. They told all of the people. They told the states, you decide who is going to oversee this program, whether it is the Board of Nursing or whether it's Department of Health or whether it's a separate entity that you create, and we will send you money so that you can run this program. So the Board of Nursing said, yeah, we'll take it. And so they did that for a number of years. The instructors would have to send in their program. If it were approved, just like with the colleges. I mean, they have to write out their program, and it is sent to the board for approval. And then you can teach it. If they don't approve it, you can teach it, but they can't test because they have to test. They can only test if they graduated from an approved program.
So at what point did you get involved? So you were at this nursing home facility and you thought, we got to do this.
Right.
And so did you approach the Wyoming State Board of Nursing around putting a program at your nursing home, or how were you involved in that process?
I wrote out a program.
So
I wrote a program for me, for my program, and I started teaching nursing assistants at Life Care. Okay. So I had a lab at the facility, and then people would come and they would sit in the class, and I would train them. And then more often than not, they would become our employees. That's the way that the law initially started out, was bring your people in, train them first, and then put them on the floor. I mean, so we were trying to train our own people so that you're not just hiring someone off the street and then having them take care of somebody. You hire them, but you have to train them before they can take care of patients. And it actually says right in the law that a student may not do physical skills on a resident until a nurse has checked them off as competent. And so it's to protect our most vulnerable. They were receiving such awful care. But it took some money to be able to put this whole program together. And so Medicare said, put it in your cost report how much this is costing your facility to train your people. And then the facilities are reimbursed based on what they submit as a cost report. There's a lot of accounting that is,
I'm sure. What was the first year that you started actually training then?
1989.
1989, you were ready to go. Who else in Wyoming was doing this?
Several facilities.
Okay.
So at the time, it was a facility-based program. So generally, it was easy to find instructors because they were generally employees of the facility. So they met the required two-year RN plus 1 year long-term care. So they met that requirement.
Yes.
And but over time, it is morphed out of the facilities, and they're not doing as much training. And now it's gone into community colleges and high schools. So you see a lot of CNA training outside of the facility. But they were, Shepherd of the Valley. Shepherd of the Valley had a program. The Star Valley Long-Term Care had a program. They were just kind of, because that was the only way that your facility could have CNAs, is they had to be trained. So,
Did you collaborate with any of the other facilities in developing your curriculum or helping them develop their curriculum?
Not at the time.
Not at the time. So it wasn't like a group of educators working together. When you did the training, was it part of your full-time position at the nursing home, or was it? It was. So it wasn't weekdays or weeknights?
No, because I was the staff development coordinator, and so that was just part of my job.
Okay. And so how long did you do that? And then tell us about the transitioning between, there's something that has to do with the Department of Health and the Board of Nursing.
Mm-hmm.
Tell us about what that looked like and when that was.
Okay. So the Board of Nursing had taken basically everything. They were doing they were approving the programs.
Mm-hmm.
They were providing the exams.
Mm-hmm. Mm-hmm.
They were accepting the exams and their and the scores,
Mm-hmm.
and then they were issuing nurse and CNA certificates
Mm-hmm.
to the people that took the test.
Yes.
So everything
Yes.
was done through the
Yes.
Board of Nursing.
Yes.
And this was a full-time job for one person to be doing
Yes.
all of this for all of the little programs around the state.
Mm-hmm. Mm-hmm.
As part of the federal law, it says that each state must develop a registry of anyone working in a long-term care facility that has gone through the CNA program.
Yes.
So we tell our CNAs, if you're going to work in long-term care, you must go to the Department of Health's website and sign up on this registry. But years ago, we didn't have a registry because our Board of Nursing was taking the candidates that had gone through the program and had tested and had scored and they had received a certificate.
Mm-hmm.
That was considered their registry. It's the list of people that are certified in our state.
Yes. Yes.
But in order to do all that,
Mm-hmm.
the Board of Nursing was charging an administration fee
Mm-hmm.
so that they could fill out the paperwork, and just like with the nurses, we have to pay a fee.
Mm-hmm.
And so, and I can't remember the exact year, but the feds found out that WNA was keeping a list of everybody that was certified.
Mm-hmm.
But in order to create the list, they were charging them. It's in the law that they cannot be charged. They cannot be charged
Yes.
to be put on a registry.
Mm-hmm.
So what happened was the Department of Health said, we'll make a registry. So you have a list of people that are certified, but we'll have a list of people that are on the registry. And at the same time, the Board of Nursing said, I don't know if they actually said this, but they said, why don't you just take the whole program? And so they did. They said Board of Nursing turned over CNA program
Uh-huh.
to the Department of Health.
Uh-huh.
So now all that the Board of Nursing is doing
Mm-hmm.
is receiving test scores so they can issue a certificate, much like they receive NCLEX scores so
Yes.
they can submit, they can give out a license. Well,
Yes.
so that's all they do. It's
Uh-huh.
like, we're going to contract with a testing agency, and then these people will test, just like NCLEX,
Mm-hmm.
and then we'll receive the scores, and if they passed, we're going to issue the certificate.
Mm-hmm.
But as far as the program and how the program runs and who is teaching and surveying the program, we're going to give that to the Department of Health. So Department of Health took it. So we have two separate entities. We actually have three. You have the Department of Health that runs programs.
Uh-huh.
You have the Board of Nursing that issues the certificates, and then you have a third testing agency that actually runs the testing part of the whole program.
Toni, so back in '89, you developed the curriculum at the nursing home. You started teaching the nursing assistants and helping facilitate them taking their exam and becoming certified.
Mm-hmm.
So how did your role change as all of this was developing and the different organizations were getting involved in all of this? Talk about what you were doing then during all of this.
Well, part of what I did was I was a nurse that tested.
Mm-hmm.
So I was doing testing evaluations, and students would come in and we had a form that we had to follow, and they would actually do the testing part.
Mm-hmm. Mm-hmm.
Well, we're testing in many sites all over the state.
Mm-hmm.
And at the time, they needed somebody to kind of oversee all these different testing sites.
Mm-hmm.
So I applied to be the state exam coordinator.
Mm-hmm.
And my job was to train evaluators and monitor and make sure that evaluators were conducting the test as was supposed to be. So I would travel around the state, and I would make sure that nurses were testing appropriately. When the Board of Nursing still had program, so they changed over in the, I want to say 2010, 2000, I can't remember the year, but prior to the Board of Nursing giving the whole program to Department of Health, they contracted with me because, again, part of the law is that all programs will be surveyed sometime every 2 years. So the Board of Nursing contracted me to go out and survey all of the CNA programs in the state. And they had a form that I had to fill out, but I would have to sit down with every instructor. I would have to ask them about different parts of their program. I would have to look at their facility, look at their equipment, and decide on is this appropriate? Is it falling within the letter of the law? So at the time, I got to go to every single long-term care or nursing assistant program in the state.
Okay.
So
Toni, you were working for the Board of Nursing then, going around and assessing and evaluating these CNA programs in the state until around 2010. And then you transitioned into a new role. So tell us about what that looked like.
Because Cheryl Kosky, who was the executive director at the time, knew me really well, a bill came down the pike that wasn't going to be a very, very good bill. And so she had asked me if I would consider testifying for this bill as a nurse. A nurse who is very familiar with long-term care facilities and CNAs, because the bill at the time was to allow nursing assistants to pass meds. And there was really not much to the bill other than they could just pass meds. And we didn't think that would be a very good idea. So together with the Wyoming Nurses Association and the Board of Nursing, because the board are government workers, they cannot lobby. They can provide information, but they cannot lobby. And we're trying to get our legislators to vote a certain way. So that's lobby. And so we were opposed to this bill, and so I spoke in opposition along with a couple of other people. There were some folks that spoke in favor of the bill. They thought that this would be a good thing to allow nursing assistants to pass meds, would free up the nurse. And we just didn't think that was a good idea at the time. And so we had a strong enough lobby, and we convinced enough legislators that this was not a good idea, and the bill did not make it out of committee. So it basically was dead at that point. That was in the legislative session in February of that year. September, we have a conference, a nursing assistant, WNA had a conference, and Cheryl and I believe it was Veronica Taylor pulled me aside and said, we have a suggestion and an offer, and we really would like you to accept. Wyoming Nurses Association at the time had a lobbyist, but they were a contract lobbyist. They weren't a nurse. And so they really didn't quite understand what the nursing role was. And so they went ahead and let her go, and I accepted the position as a lobbyist and have been a lobbyist ever since.
Fantastic. So they did have a lobbyist, but it wasn't a nurse. So you were their first nurse lobbyist, and so you've seen through the WNA now for many years.
Yes, actually, I wasn't their first nurse lobbyist. They had a nurse lobbyist, Loretta Wolf, and she decided to stop lobbying, and so because we had a break, they brought in a contract lobbyist between Loretta and myself. But yes, so that's when I started.
So besides being the WNA lobbyist since around 2010 then, so you also run a business. You're an entrepreneur for nursing, which is still very rare. So tell us a little bit about your business and being an entrepreneur here in Wyoming.
So I actually, so my business is an American Heart Association training center. And so part of what I do is I teach first aid CPR, but I also teach instructors how to be instructors. But part of my job is to monitor and to make sure that they're doing things according to the American Heart Association guidelines. I don't have to be a registered nurse to do that. It's beneficial, but the Board of Nursing's requirement is that you must hold a job that requires you to be a registered nurse in order to stay licensed. My job as the lobbyist, they require me to be an RN. And so I meet that role, but I've also done some work with the Department of Health. I helped to write the rules for birthing centers and freestanding emergency centers, and they pulled me in because of my RN experience. And then I also volunteered during Frontier Days as a registered nurse. I work in the first aid station, and so I'm in my professional role when I do that. So I do very slow projects because of my role as an RN. But my business, it's beneficial to be an RN because I have a lot of folks who have lots and lots of questions, medical questions and whatnot. So it's nice. It's nice that I have that background to be able to help them.
Absolutely.
Yeah.
So, what are you most proud of about your nursing career, Toni?
I read that question and I thought about it, and I thought, what am I most proud of? I guess it's a variety of things. I really. Even though when I graduated from nursing school, I had no plans on going into a legislative realm, but I am proud of the fact that we have moved some legislation, and we've opposed some legislation that would not be good for nurses or the state. So I'm proud of that. I'm proud of my when I worked in labor and delivery, I felt like I was a really good nurse, and I had people that still come up to me and go, "You were my nurse when I had my baby." And so that makes me feel good. I like the fact that we're well respected for the most part by the common public, and so I'm just proud to be part of this profession more than anything because of the people that are in it, the relationships that I've developed with many people around the state, and it was just quality people that are part of our organization and part of this profession. And my daughter's a nurse, which is, makes me very proud. My grandmother was a nurse, which makes me very proud. I made her proud. So, but it's just a great profession. And I encourage people who think, oh, should I go into nursing? It's like, it's a great profession. There's bumps and, and grooves along the way, just like any job. But I never discourage anybody from going into nursing because I think, or health care in general, it's tough, but it's so fulfilling. So on so many levels, that's why it's a lot, a lot of different things.
That's a great answer, Toni. Is there anything else that you want to add for our viewers to know about you and your career here in Wyoming as a nurse?
I hope, God willing, that I'm able to keep doing it for a while longer. My husband's retired. He's at home right now saying, "What is there to do today?" So I look at some of our colleagues that Mary Behrens and Veronica and some of these folks that have been in it for a long time, are still in it, still active, even as we get a little older. I really, really, really wish that more youngsters would kind of come into the fold, and really see that being a good staff nurse and doing the nursing care that you're doing for your residents or patients is great, but expanding yourself and I know that families are important, young families are important, but there's so much work that can be added on to, and we don't need a lot of time. We need a little time from a lot of people, and it continue to make our profession great.
Very good. Thank you, Toni, for speaking with me and for sharing more about your history and not only of your nursing career, but for our state here in Wyoming history. So thank you very much for watching, and thanks to Toni for joining us.
Thank you for having me.